with CSIR, one of the national lab. And I wholeheartedly welcome Dr. Anita Bhushan to talk to us on this topic. And I welcome all the participants who patiently waited during the technical delay. And thank you so much for selecting us to spend your valuable time today with us. And I welcome all the teachers who are behind this from Department of Zoology as well as other departments. If I take, there are many names to take, and all the departments of Nirmala College who are standing behind this program with technical and all other support. I welcome all of you to this webinar. And once again, I extend a warm welcome to all of you to this wonderful seminar. And I invite Dr. Anita Bhushan to talk to us, to introduce us to the new problems faced by diabetic people. And before starting, let me point out some of the important points. First one, kindly all the participants may kindly pin the speaker. Kindly pin the speaker. Second thing, you may kindly type your questions in the chat box. And please kindly mute your audio and video. Okay. And thank you so much. Once again, I welcome you all. And I welcome Dr. Anita Bhushan to kindly present. Thank you so much.
Hi, good morning, everybody. And thank you, Annie, for this big introduction. My name is Dr. Anita Bhushan. I am MD in internal medicine. I studied from Gandhi Medical College, Bhopal, did my MD in internal medicine. And for a couple of years, I was there in CSIR, and that is where I met Annie. She's a gem of a person. I can say only one thing. She has been a very nice friend, a very nice human being, and I cherish the relationship which we share. I welcome you all on this talk about diabetes and COVID-19. I can start directly now, Annie, if you say.
Yeah, please start.
Okay. So we will talk about diabetes. We will talk about COVID-19. And then we will talk how do all these things help us to understand the correlation between these two. It's a PowerPoint presentation. I know it is not that interesting to just go on throwing slides at you people, but webinar is something that we have to work like that only. But I will definitely love to entertain all the questions which you people are having. Are you all able to see the PowerPoint presentation?
Yes.
Okay. Thank you, Annie. Thank you very much. Wonderful. So we start from managing diabetes during the COVID-19 pandemic. So if we start from the COVID-19, this COVID-19 has brought the entire world's focus to health. Unexpectedly, the world was going at its own pace, and suddenly everything has stopped. And it's perhaps as never before, we all are collectively worried only about one thing, and that is health. And the rapidity of this spread across the globe with such huge morbidity and mortality is really a big mystery or enigma. So now what is this COVID-19? I know you all must have read it in all the media, newspaper, magazines, journals, but some passing words about COVID-19, which is a coronavirus disease, which is caused by SARS-CoV-2. SARS is severe acute respiratory syndrome. The word itself tells us that one, it is severe. Second, it is acute. Acute means it will come very fast, do what it has to do, and goes away. And it mainly involves the respiratory system. And it's a syndrome. Syndrome again means it is not one symptom, it is a collection of symptoms. So the word itself is self-explanatory that it is severe, it is acute, it is of respiratory syndrome, and it is a syndrome. We have seen that it has spread quickly to more than 160 countries across the world. Why did it spread so fast? The only reason being the transmission is through respiratory droplets. The incubation period of this virus is around 6 to 8 days. Incubation period, you must be aware, is the period when the virus enters the body and when it starts producing symptoms. That is around 6 to 8 days. To give you an comparison, like typhoid fever, it's caused by a bacteria like Salmonella typhi. The incubation period of that is around 10 to 14 days. So you eat something which is infected with Salmonella, you will develop typhoid in 10 to 14 days. Similarly, for this COVID-19, the incubation period is around 6 to 8 days. Then follows the period of around 7 to 10 days of the symptomatic disease. The symptoms mainly include the common symptoms of any respiratory problem or any influenza or any cough and cold, that the patient will have cough, fever, body ache, respiratory problems. If not taken care of, or if the immunity is poor, it can progress to a pneumonia and then respiratory failure. What has been seen that the patient or the person who gets infected, he would definitely try to ignore the initial symptoms. And the hospital admission from the day the symptoms start is usually 6 to 7 days. This is where all the devastation takes place. Some people may be infectious, some may not be infectious during that period. They may be symptomatic, they may be asymptomatic, they may have mild symptoms, but still the virus is there in the body. The virus is there, and if not taken care of, that virus will multiply. Now comes the role of medication and immunity. These are the two factors which will tell us what course will the virus take place. Now, what we have seen is that the virus starts multiplying in the body. As it starts multiplying in the body, the immunity starts attacking it. You all are science students, you know what is immunity. So the immunity is that the body or nature has given a capacity to human body to attack any foreign pathogen invading our body. And this is done in simple infections by different types of cells, like simply WBCs, eosinophils. These are the simple cells which help in attacking the pathogen. And in simple infections, these cells, to a certain extent, are able to control the infection. But what happens, this is not always the scenario. Gradually, the body when it's not able to cope up, it starts producing many more types of cells, and those cells start secreting many more types of chemicals. Like some cells called macrophages are there. They might secrete cytokinins. They might secrete tumor necrosis factors. They might secrete interleukins. You must have heard a very common word, cytokinin storm, in relation to COVID. And what is that? That is, the body knows that the virus is foreign agent. I have to take care of it. So body starts making those cells like macrophages, like cytokinins. And these chemicals then start attacking the virus. But the unfortunate part is these cells don't know how much amount of secretion they have to produce to kill the virus. So there has to be a delicate balance. And that balance is lost usually. Sometimes the balance is appropriate. The chemicals, the immunoagents, they kill the virus and the person heals. Sometimes the viral load is more, so that even though the immunity might be there, that is not helpful to take care of the infection. And sometimes this immunological agents are produced in such a huge amount that they overpower the virus, and they themselves, since they are chemicals, they start attacking the different tissues of the body. They stop realizing what is self and what is not self. They don't recognize that this is host and this is pathogen. They only need to secrete their chemicals and go on destroying the tissue around them. That is where is the problem in all these infections, be it HIV, be it COVID-19, be it other immunological disorders. They all are mainly because the body is not able to understand how much secretions are needed to kill that pathogen. So these chemicals which are secreted in the body start attacking the different tissues of the body, be it mucosal lining of the mouth or nose, leading to altered sensation of taste and smell. They may attack the mucosal lining of the lungs, that may lead to a lot of pneumonia. They may attack the coagulation process. They may initiate certain processes which may lead to some other complications in the body. So this is what COVID-19 is doing. COVID-19 is entering the body. It is a virus. And secondly, it is an RNA virus, more so dangerous. You know what is a DNA virus. You know what is an RNA virus. DNA is double-stranded and RNA is single-stranded. DNA viruses are little easy to manage. Why? Because one, they have double strand and they can be attacked, and their replication needs proofreading. So if you want to treat a disease which is through DNA virus, it can be managed. But RNA virus, it's very difficult. Being single stranded, they don't have that proofreading. So what happens, if you want to kill that virus, it becomes very difficult. And its rate of multiplication is very fast. And more so problem is, when they multiply, they have a tendency to undergo mutations. So a DNA virus, you can produce a vaccine easily, you can attack it, and you have drugs for it. Whereas for RNA viruses, being a single-stranded virus, its multiplication is very fast, and it goes it goes unabated because it doesn't have any proofreading, and it has the tendency of mutations. Even in this COVID-19, recent studies have shown that what species or what RNA virus was seen in Wuhan and what has been discovered in certain countries now, the mutation has already occurred. And there are around 8 to 10 mutant forms which are being recognized. This makes the treatment, the control, the production of vaccine very, very difficult. If you know RNA viruses, one of them is measles, and it took around more than 20 years for the vaccine to be produced. So now, how to treat this RNA virus? How to take care of this COVID scenario? There have been lot of studies going on. There is no definitive treatment because if you remember January or February, it was difficult for any country to understand that yes, a severe pandemic is coming towards. So it took a while for the clinicians, for the medical professionals to understand that yes, something has to be done. And it has hardly been 3 or 4 months. But still, different modes of treatment have been tried with variable results. Yes, zinc, vitamin C, vitamins, all are one big part of the treatment, but they are not the definitive treatment. They will be a supportive treatment. But what is the main treatment? There has no definite consensus on this. The first which came with a big bang was hydroxychloroquine and chloroquine, which is an anti-malarial which is being used in South Asian countries since ages for malaria. But unfortunately, in Western world, that was not used so much because malaria is not prevalent in that part of the world. So what happened? Chloroquine was being used and some results were seen, but then came the side effects of chloroquine because chloroquine is a drug which alters the timing of heartbeat from one part of the heart to the another part. That led to some conduction problems in the heart. And so that was something which really made it very difficult to continue with chloroquine. Then came the RNA polymerase inhibitor remdesivir. Right now, that is what is being mainly used in US because they feel that this being an inhibitor of the polymerase enzyme does lead to decrease in the multiplication of the RNA virus. Even lopinavir and ritonavir, they have also been used, which have been used in HIV. And certain immunomodulatory agents are also being tried. And I read it a couple of weeks back only. Some latest journals are right now coming up with treatment through aspirin and steroids. That is why, because certain studies in Italy have seen, and they believe, because that is what the presentation they have seen, that COVID-19 is producing pneumonias or respiratory problems, not because of the collection of mucus, but because COVID-19 is initiating the coagulation process. And they are absolutely right on it because of the immunological response. Not only the chemicals are secreted, but certain aberrant processes are initiated, like coagulation process, that is stimulated. And that is where multiple pulmonary emboli are formed, pulmonary infarct is formed. So those studies have come up with the option that aspirin, an anticoagulant, is the baseline of treatment, and there has been good results. The Italian studies say that. Some have come up with the option of corticosteroids because they are a very good anti-inflammatory agents, and COVID-19 they consider as an inflammatory disease. They consider that that is also one of a big success in the treatment of COVID-19. So now this is all about COVID-19, which I think should be enough for you people to understand so that we can proceed to learn a little bit about diabetes and then how to manage COVID-19 in people with diabetes. Are you people comfortable with this?
Yeah, yes, yes.
Yes, Annie? Okay.
Yeah, yeah, sure, sure.
Okay. So now we know that COVID-19 is an infection. It's a viral infection, mainly involves lung. It leads to mechanical uh, respiratory and mechanical respiratory problems and chemical problems and altered immunological responses. There is no definitive treatment. It's a new disease, so researches are going on, and that is one more reason that finding a vaccine has been a really uphill task because the virus is multiplying so fast that to replicate its chain of sequence is becoming difficult. They are trying with live vaccine, inactive vaccine, or they are trying to create genetically. All is going on. Moderna recently only came, I suppose, only a week or 10 days back, they came up with the phase 3 trial, taking into account some 30,000 patients. Phase 1 trial, which mainly includes the safety, was fairly successful. Phase 2 trial for dose is also doing fine. They are happy with the results. And now is the double blind trial in open population to see for all the side effects, all the actions, how much amount of antibody is being produced, what it is. So Moderna company is right now in the phase 3 trial. There are many companies which are working on it. Pfizer in India is also doing good, and we are expecting something good coming up soon. But it's all because it's an RNA virus that it is becoming really challenging for the researchers and scientists. Now, what happens if this COVID-19 infection happens to a diabetic? That is one COVID-19, another diabetes. They both are a big, major risk for any human being. And studies have shown that diabetes is not only the risk factor, it is one of the worst risk factor for the severity of COVID-19. So, on one hand, diabetic patients have to control their sugars during this adverse time with such limited resources. And on the other hand, they have to protect themselves from the COVID-19 infection. And all the studies done so far have indicated that yes, diabetes is one of the major risk factors which leads to repeated hospitalization or mortality. There have been studies during this 3 or 4 months period only in small group of patients which have seen that more than 15%, something between 15 to 20% of the patient who have been hospitalized are diabetic. And even persons who have died of COVID-19, more than 20% were diabetics. So studies are still going on, but these are very small studies from different hospitals in which they are comparing the mortality and morbidity in intensive care, non-intensive care patients. China did a lot of studies to see that how is it working on. One basic first study, which was done in France, came out with really wonderful results. There is a publication called Diabetology, and the study shows that the diabetics, mainly who had some micro or macrovascular complications, were really in a very bad shape, and that They really couldn't take up the COVID-19 infection properly, and they had to succumb, or they had more severe outcomes, or they had to be on ventilators, or mortality was really very high. It was done in France, and they had around 1,500 patients in that study, and they really were concluded that yes, diabetes is one of the disease that really alters the fate of a COVID-19 patient. Then even one study was done in Wuhan in the early days, but they did the study by doing the postmortem also. And what they found out was that diabetics, again, that study was small, around 200 patients, that majority of the patients who were having complications were diabetic. So there are, in this limited period of time, whatever studies have come up, they all are showing that patients who died, or who had severe morbidity, or who had to be on ventilators, or who have developed complication, majority of them had one or the other comorbid conditions. So what are those comorbid conditions? One is, yes, diabetes, no doubt about it. Another is hypertension, and one is cardiovascular disease, and some are pre-existing lung diseases. So the COVID-19 person, if has either diabetes or hypertension or any cardiovascular disease or lung disease, that patient is deemed to have one or the other complications, or the use of ventilator is more amongst them, or death rate is very high among them. And this is not the first time that diabetes has been found to be a culprit. Diabetes was also a risk factor for severe disease and mortality in the previous SARS and MERS, the Middle East Respiratory Syndrome, and even for influenza. So it's not something new that diabetes has been a risk factor right now for COVID. It has been seen frequently in many diseases that yes, diabetes is something which alters the disease process, which changes the scenario of the disease. So why does diabetes do that? We can study that, but first let us know what is diabetes. What is that diabetes does, that it affects all the organ system to an extent that even any disease which happens takes a very downhill course. So now let us talk a little bit about diabetes. And why to talk about diabetes? Why it is so important to talk about diabetes? Is diabetes that important? Yes, diabetes is very important. Not just because it is causing downward trend in COVID-19, but it is creating a great havoc throughout the world, the way it is coming up and involving and attacking the human population. So this is a table, if you can see, of 2015, and you see the top 10 countries, China, India, and US, the top 3 in terms of people with diabetes. And if you can see what they have projected in only 25 years, is literally the disease is going at a very high pace. The graph is very steep. China, which right now is around 110 million in 2015, is projected to go up to 150. But see, what about India, which is around 70 million in 2015? We are expecting that in 25 years, it will literally get double up. So diabetes is something which is present throughout the world. It's not like malaria, which is seen only in South Asian countries. It's not like any other infectious disease which is seen in developing world. It is a disease which is touching every human being. Initially, yes, it was considered to be a disease of well fed people, of metros, but now even the urban population, the town people also are developing this disease. And you can see from this very clearly that we are really trying to come up to the level to win this race of diabetic cases. So, what is diabetes? There are many organs in the body, and one organ among them is pancreas. Pancreas is an organ which secretes insulin. Long back, the understanding was that diabetes is a disease in which pancreas is not secreting enough insulin. Yes, that still is the main thing, that pancreas is not secreting, producing enough insulin. Or if it is secreting adequate amount of the insulin, the body is not able to respond to it properly, or the body mass is more, or the receptors for the insulin are altered. So, yes, still the main definition is that diabetes is a disease in which enough insulin is not being produced or the body is not being responding to it. And thereby it was considered to be an endocrine disorder around 25 to 30 years back. But then gradually the knowledge, the researchers came up that it's not only the insulin that is creating all the problems in the diabetes. It is not only the it's not only the carbohydrate metabolism. It even includes the fat metabolism. It even includes the protein metabolism. And only these three metabolism? No, it is much beyond that. What is beyond that? It is creating an altered metabolic process in the body. And so gradually the endocrinologists were told that no, you cannot label it as your domain. It was considered to be a metabolic disorder. But gradually it was seen that what are the organs mainly attacked by diabetes? It was seen that, oh my God, kidney is getting involved. Why? Because the blood vessels going to the kidneys because of diabetes have developed clots, have developed atherosclerosis. The microvessels going into the eye are involved. So gradually it was considered that it is a vascular disorder. So if you understand it, diabetes is just not simple definition or deficiency of insulin. It is much more beyond and more dangerous. That is, it involves metabolism, but it involves all the organ systems. And certain things go hand in hand with diabetes. But first, let us see how many types of diabetes are there. You all must be aware it's type 1, type 2, gestational diabetes. Type 1 diabetes is mainly seen in the young teenage to young adults. That is mainly because of no secretion of insulin. There is absolutely no secretion of insulin. And so the person presents very early on in the age and with more dramatic symptoms because there is no insulin. So carbohydrate metabolism absolutely stops and the person lands up into ketoacidosis and coma. Initially, it was only when the patient landed into coma that it was being diagnosed. But now gradually the awareness and education and the availability of easy blood testing has made the diagnosis of type 1 diabetes a little more convenient. Then we come to type 2 diabetes, which is the most common, the most prevalent one, which at one time was considered to be a disease of old people and then middle-aged, but nowadays it is racing towards 30, 35 years also, you can find diabetes. mainly because of the sedentary lifestyle, the eating habits, the genetic background. You can blame anything for it, you know. And one is the gestational diabetes. The gestational diabetes is mainly seen in pregnant females, and it has mainly some genetic predisposition. Yes, we can add lifestyle and eating habits also to it, but then mainly it's the genetic predisposition. So these are broadly speaking the common classification of diabetes and the definition of diabetes. Now, if we go to what are the signs and symptoms of diabetes, the classic teaching around 40 years back was polydipsia, polyphagia, polyuria. The three P stands for the diabetes mellitus. But now it's gone beyond that. These symptoms are probably very late to come up. Before that, only the person may present with lot of varied symptoms which are not directly related to diabetes. So diabetes cannot be diagnosed by any symptom. It is not that if a person feels dull and lethargic, you say, oh, you might be having diabetes. No. Still, the main cornerstone of diagnosis of diabetes rests on only one thing, the blood sugar measurement. But the best part is blood sugar management, which was once considered to be a process in which you have to fast, you have to go to the lab and get it done. Now it has come to your doorstep. Yes, a glucometer, probably not very expensive, is available readily in all small towns, can be brought and can be used by a layman without much education, you say. It's just a simple prick and the person can be diagnosed. Yes, a random blood sugar of more than 170, 180, it's an alarming thing. And this common awareness has led to more and more diagnosis of diabetes. Now, the classic symptomatology of polydipsia, polyphagia, polyuria is only a bookish knowledge. Everybody has to think much more beyond this, that are these signs and symptoms suggestive of diabetes? Can the person have diabetes? Since his parents have diabetes, can he also have diabetes? Is he having unnecessary nausea and vomiting? Should we get him checked? So these are certain things that should raise an alarm or red flag that yes, something has to be done if common symptoms are prevalent for a pretty long time. So now, what is the scenario of diabetes in India? I have this table and it is very scary to see. I didn't feel like putting it on this presentation because it really scared me. I was not able to believe that 2019 we have 77 million people with diabetes. It was really very, very disheartening for me to see that this is the amount of load on India in terms of diabetes. And the worst part is half of the people even are unaware about it. If you see, it's 43.9 million people with undiagnosed, and the prevalence is 9%. Practically every 10th person is a diabetic. And if I see of this, 1 million diabetes related deaths were there in 2019. So, do you feel that it is something not alarming? It is something which is really bothering any medical professional, that this is the amount of load on the health department. And then how to deal with this? How to deal with this comes only when we know that yes, this is the amount of load. This is one more map. You do need not worry about it. It was in 1990 what I was seeing, that there were hardly few cases in one or two states. And you see the scenario in 2016. It's all patched up, red and red. So yes, the scenario is very bad regarding diabetes. About 1 in every 2 Indians living with diabetes is unaware of their condition. It's something which pinches us. And only about quarter of people who know are really able to bring it under control. And it's not that it's present in any one part of India. A lot of studies have taken place. The epidemiology, if you study, Goa had the highest prevalence of diabetes, followed by Andaman, Nicobar, and yes, Kerala. They say that the studies have shown the southern states have a little higher prevalence. But yes, though Goa has the highest prevalence, the awareness about diabetes is highest in Kerala. And I congratulate you all for that. It's the place of God, so definitely it had to be. And that is what is good, that there is a lot of awareness about diabetes. That is, 7 in 10 patients were aware of their condition. That is where our fight is. That is where we have to work for. That yes, at least people should be aware, they should be diagnosed, they should be motivated to control this state. Then comes that we can reduce it. Now, diabetes usually never comes alone. It tries to walk with something or the other. So, what is that diabetes loves to be associated with? What we have seen, or different studies have come up, is that many patients of type 2 diabetes are obese. And obesity in itself is a risk factor for severe infections. And this is not something new. This was known since 2009 when H1N1 epidemic happened, that the disease was more severe and lasted for longer duration in patients with obesity who had to be ultimately treated in intensive care units, specifically this abdominal obesity. So, what is there that makes abdominal obesity such a dangerous thing? Um, if you understand obesity, we know that whenever the fat collects, it starts getting deposited in the abdomen. And gradually, this fat gets transformed into fat cells. And these cells start behaving as an independent units. And these independent units then start secreting certain chemicals, certain hormones. And you will be surprised, rather shocked to know that they secrete something like adipokinins, cytokinins, tumor necrosis factor, interferons. These must be little overwhelming words for you. I know, I can understand. No worries, don't go into that detail. But what is important is these chemicals, what do? They alter the immune response totally. So, what happens because of these chemicals? If you remember, I had told you the cytokinin storm, similar situation arises here also. Because they are producing a lot of cytokinins, the immunity of an obese individual will definitely be impaired. So, obesity in itself, except for the looks part, I understand, it has something much more beyond that. And that is, it does impair the immunity. And is that all that bothers abdominal obesity to a person? No, it goes much beyond that. And what is that? It is that this abdominal obesity also has some mechanical repercussions also. If you understand the human body, there are two parts, thorax and abdomen. Thorax is the part where there is heart, there is lung, there is esophagus. Then is a layer of muscular tissue which is called diaphragm, which separates the thorax from the underlying part, abdomen, which contains liver, spleen, stomach, pancreas. So what happens? Because of this abdominal obesity, these fat cells start taking a lot of space, and that pushes the diaphragm upwards, which leads to mechanical respiratory problems. So, one, it is the impairment of the immune response. Secondly, this obesity is causing mechanical respiratory problems. Now, one more thing is there that obese patients have reduced oxygen and carbon dioxide gas exchange in the lungs, which again leads to a reduced oxygenation of the blood. This was not enough. They have an increased risk of asthma. They will have more symptoms and rather frequent attacks of asthma. And they are so poor in responding to these medications. Is this all enough? No. Comes the new thing, which is around the corner, which says that obesity does have an angle of sleep apnea. What is sleep apnea? Those are the periods in which the carbon dioxide and oxygen exchange is not happening because the brain is not sending that signals, and it becomes a vicious cycle. Obesity leading to sleep apnea leading to obesity. And with all this, leading to diabetes, leading to hypertension, leading to altered metabolic phase of the body. So, obesity in itself, which is always trying to walk with diabetes, has lot many implications and repercussions in terms of causing the altered immune response and respiratory problems. So now, why are these diabetics at an increased risk of infections? One, definitely, poor glucose control does impair that aspect of immune response. And diabetic patients have an impaired immune response to infection, both in relation to cytokinin profile and to changes in immune response, including to T cell and macrophage activation. So they are attacked from all the sides. It is likely that many of the patients with diabetes in China must be having some poor blood glucose control when they were infected with COVID-19. This is what is coming up frequently in all the research papers, but they don't have any conclusive evidence because it has been too late to know about the blood glucose control posthumously. Now, as we said, obesity, we told you about diabetes. Now, another parameter of this is metabolic syndrome. This is something around 20-25 years back, researchers found that diabetes and obesity both were big killers, but they felt that there was something more to it, was something that despite that adequate sugar control was there, but still the metabolism was being disturbed badly. And then was the term coined, the metabolic syndrome. What is metabolic syndrome? They consider it a derangement in the metabolism. And syndrome, why? Because it doesn't contain only one thing in it, it has 5 angles to it. Yes, one amongst them, the biggest thing is the diabetes. Second, the obesity. Third, the triglycerides and HDL. These are the lipids or the fats which are there in the blood, and along with them comes the elevated blood pressure. So these all 5 are the elements of metabolic syndrome, and if any person has at least 3 of them, he is having metabolic syndrome and he is at a very high risk of developing severe cardiovascular problems like heart attacks, like anginas. He is at a very high risk of brain stroke. He has a very high risk of other disorders which cannot be directly correlated today. They need more researchers like Alzheimer's, like Parkinsonism, to the extent certain researchers now have even come to conclusion that these people are at more risk of developing certain types of immunological disorders and malignancies. So we are not only talking about diabetes, which is one of the main thing, rather the topic of talk today, but I cannot leave metabolic syndrome behind if I'm talking about diabetes. I cannot leave obesity behind. I cannot leave blood pressure behind, because they all really work together and usually are present. Out of these five, at least two or three will be present in majority of the middle-aged adult people who are having. Even one of these will sooner or later develop the rest. So we need to know about metabolic syndrome. And now comes, how is all that related to us in terms of COVID-19? So a recent meta-analysis from China was done in around 50,000 of patients. And what did they see? If you really see, it's around 50% of the patient had one or the other thing. Roughly around 20% were hypertensive, more than 10% were diabetic, around 10% were cardiovascular, and around 3% had respiratory disease. So if you see this chart, you are able to conclude that these comorbid conditions are something which are of concern, because they are the reason that COVID-19 progresses to ventilators, to death. So taking these parameters, taking this scenario, now comes how to work on all these. We know for COVID-19 what we need to do right now, that I'll touch at the end. But now we should also know what is the mainstay of treatment of diabetes. I will not go much in detail about it, but yes, I would like you people to just get a refreshed view about it. The cornerstone of diabetes management. Yes, it starts with food. It starts with mouth. It starts there only. Yes, healthy eating, exercise. So are these two enough? Or you are taking medication and is that enough? No, I don't think so. Monitoring is one of the biggest thing which will help you or any patient to understand the effect. You study, you read, you prepare, and you do. But only when it is the test or exams do you come to know that you have really comprehended the topic, or you have really understood the topic, or you really have studied it. So until and unless we do a regular monitoring, what is healthy eating or exercise or medication doing is really not clear, is really not helpful. Yes, monitoring is one major thing which has to be taken care of. And for that, you need a lot of awareness and education in the masses. And that makes it more motivating for any patient to go in for a healthy eating and exercise. Medicines, definitely, yes, they have a big role, because diabetes, if you say, I have not written cure of diabetes, I have not written treatment of diabetes, it's only management of diabetes. Despite all claims from different alternative medicines about treating diabetes, since they don't have a lot of research, double-blind trials, we are not able to comment on it. But yes, diabetes is a disease which can be managed effectively if the patient is educated, made aware, and keeps on monitoring his condition. So I don't claim about any treatment in allopathy that this will treat diabetes. No, nothing of that sort. But yes, healthy eating, exercise, monitoring, medicines, and this all with the help and cooperation of healthcare team does help a diabetic patient to go long way with minimal complications. So now we need to see that the monitoring helps us to see that yes, a good glucose control is there to avoid all the serious infections, to avoid all the adverse outcome. So if you have a good glycemic control, the risk of infections can be reduced. And to maintain this optimal glycemic control, frequent glucose monitoring and changes in anti-diabetic treatment to come to that level are absolutely mandate. Sometimes what happens, patient starts with a particular dose of medicine and he feels I'm good, I've taken the medicine, and then years pass on, they continue with the same medicine despite knowing that the disease might have progressed, the disease might have started attacking different organs because they are not checking their sugars regularly. Now, it is important in the present scenario that this vulnerable population of diabetic people with high risk of exposure to the virus, how it can be done, it is by rigorous personal hygiene and minimal direct social contact. You have been hearing about this like anything. I would not say anything. You are beyond this, but yes, personal hygiene is definitely one of the big things to be taken care of. Yes, social distancing for COVID 19, it is challenging, no doubt about it. But because a diabetic person, if happens to be living alone, he or she should always be in communication with one or the other family members or friends or healthcare providers. They should avoid crowded places, but then they need extra vigilance. One, that they are protected from the virus and their diabetic needs are also met. As a community, what has to be done is there should be some voluntary NGOs which should work along with the patients, along with the local council to identify the needs of such diabetic people and to detect who are frail, to provide sufficient advice, to care give, to advise them to minimize the risk of this group to becoming infected with coronavirus. So it is incumbent on local services to identify a local plan to address the needs of this. This is an acronym for a diabetic, how to take care. Yes, you need to check your blood sugar frequently, always take your insulin, make sure that carbs are not over or under, and be sure that yes, ketone levels are checked. But we have to be very clear that such patients don't end up into a critical phase. There is a severe phase, that is when they require oxygen supplementation, but we have to see that they don't end up into a critical stage that they need mechanical ventilation or high flow oxygenation. Passing word on telemedicine, because that has come up in western part of the world very nicely during last 4 months. All the patients have been consulting their doctors, the primary care, the community medical officers through telemedicine. That definitely will help and prevent any further deterioration. And that is very easy. If self-monitoring is done, the dose titration can be done, and things can be taken care of. You all are aware about all the diabetic diets, carbohydrate, fats, proteins, fibers, what right choices are there, what are food to be avoided, what should be done, what should not be done, and what are the big exercises schedule which should be followed. And to summarize in the end, now you must be aware what is COVID-19, what is diabetes, why COVID-19 and diabetes have to be studied in relation to the morbidity and mortality. How is diabetes a big risk factor? what is associated with diabetes, and what should be done at personal level, at community level, at national level. There are good medications for diabetes, no doubt about it, which are being used since long time. Some newer drugs are also coming up, which are very good, which help in prevention of the complications, which are little expensive but have less side effects. Those can be very easily used, are available throughout the world. And type 1 patient mainly need to use insulin. The biggest problem with insulin is that insulin has to be taken in injection form. That is where the patient is hesitant. But unfortunately, sorry, the insulin is a compound which cannot is not stable in solid form. So it has to be in liquid form. It has to be given an injection. Yes, nowadays they have come up with insulin pumps and insulin inhalers, which are still on the experimental side. But yes, insulin is there. And one more thing which you might be reading in the media a lot is about the ACE inhibitors. These are the compounds which are being used in the treatment of hypertension. They are very good drugs, very nice drugs. They have a huge effect on the body, not only in helping to control blood pressure, but they really prevent kidney damage and cardiac damage. But they have little adverse outcomes with COVID-19 infections. So initially what happened, the medical field said that we need to stop using these medication. But then gradually they found that changing the medicine will definitely lead to another complication. So now international guidelines have currently come up with the consensus that we should not stop or discontinue this therapy. To summarize in last few seconds, that patients with diabetes should follow the general prevention advice, and they are a high risk group with an increased requirement for hospitalization. So they need intensive attention to reduce the fatalities. I'm thankful for all of you for giving me such wonderful opportunity.
Thank you, Dr. Anita Bhushan.
Thank you, Annie. I'm thankful
It was wonderful.
for all the patient hearing.
Yeah, there are some questions.
Yeah, I'll be more than happy to take them.
Yeah. The first question is,
Mhm.
what are the reasons for gestational diabetes?
Yeah. So gestational diabetes is mainly the diabetes during pregnancy. Most common thing which has been seen is the family history. Number one, that is the most common thing. And thereby we come to conclusion that genetic predisposition, number one. Secondly, gestational diabetes is found to sooner or later lead to the diabetes, full blown diabetes. So it has been considered that pregnancy was the breeding ground for the diabetes, that eventually that person had to be diabetic, but pregnancy precipitated it. So the genetic predisposition is one. Yes, diet and lifestyle always have to be implicated, because the changes in those have really produced good results. So, second, third is certain hormones are secreted during pregnancy, which definitely affect the metabolism of the body. Those are also one of the factors which may lead to gestational diabetes.
Okay.
Is that good?
Thank you. And the next question is,
Mhm.
what does asymptomatic stage in terms of physiology means?
Yeah. So asymptomatic stage is when the pathogen enters the body, but the load of the pathogen is not that much that it can produce clear-cut symptoms, or the immunological response of the body is such superb that it is not allowing that pathogen to produce symptoms. But this balance can tip off any time and the patient may land up into symptomatic phase. So asymptomatic phase is a win-win situation because the viral load is less, the immunity is good. If during this phase only the disease can be taken care of, we have won the battle.
Okay. And the next question is, what are the precautions taken to be taken by a diabetes patient?
Oh, yeah. So, definitely, if the person has developed diabetes, that person should be totally made aware that yes, this will sooner or later progress. That has to be accepted, number one. And secondly, usually diabetes never walks alone, as I said. It will walk with its stick of high blood pressure, cholesterol, obesity. So a diabetic has to take care that diabetic doesn't fall into the pool of metabolic syndrome. The diabetic needs to be very careful that yes, I need to avoid the rest of the features of metabolic syndrome. So that is one foremost thing that a diabetic should take care of, that no more complications. Secondly, now if I have diabetes, what I have to do is to be very energetic in controlling it, not only in terms of diet and exercise and awareness, everything what I can do. Third is to keep a regular check on certain things like eye. Eye is one organ which is sooner or later getting attacked by diabetes. It is found that the blood vessels which supply the eye may get attacked. So a regular, frequent, good eye checkup. The skin, which is prone to infection. The foot care, that is very important because diabetes also have one more manifestation, that the nerves has a covering called myelin sheath. You people must have studied. The nerve has a covering called myelin sheath. That myelin sheath gradually starts decaying, and that decay leads to the exposure of the nerve, and that leads to altered sensation. So the pain sensation, the sensory sensations are altered, and that leads to the complications of foot injuries, foot ulcers, which lead to amputation a lot in diabetics. So diabetes, since it attacks many organ systems, it is not that only one blood sugar control will help you to go a long way. It has to be taken as a big combined approach in terms of skin, in terms of eye, in terms of sugar, in terms of metabolic syndrome. All factors need to be taken care of.
Yeah, thank you. And the
Thank
next question is,
Yeah.
uh, the association between physical activity level and quality of life in patient, along with one more question,
Mhm.
why diabetic persons go thin in lockdown?
I didn't understand the last part, Annie. What? Why diabetic persons?
Go thin in lockdown. Someone might
Okay.
have got reduced of their
Okay,
weight.
okay, okay. I got it. I got it. So the first part of it, the physical activity. Physical activity is considered, or rather, if you had seen my presentation, I had kept diet and second activity, and third only did I put the medicines. I didn't label the medicines as first. So yes, physical activity stands very high in terms of management of diabetes. And physical activity does not only help you to reduce the sugar. Definitely, that is one reason, because what happens during physical activity, the muscles, receptors on the muscles get activated and they open up so that the sugar which is in the blood enters the muscle and can be used by the muscles. So chemically and physiologically, the sugar absorption and utilization is better in exercise, but exercise goes much beyond that because it improves the other metabolic processes also, like the cholesterol part, like the blood pressure part, like the bone density part, like the nervous system, like the brain activity. So exercise will help any person, be it diabetic or non-diabetic, to go a very long journey easily because it is affecting every system organ of the body. So if kidneys get good blood, the kidneys are protected. If skin is getting good blood, skin is affected. So it's not only just because sugar is being utilized that a diabetic will be fine. No, it is beyond that. It will definitely improve the bone density. So that itself is a big boon. It will definitely improve the brain functioning. It will definitely improve the nerve regeneration. So physical activity is one big thing. Now, second part of the question, what I understood was, why do diabetics get thin during a lockdown? So the scenario is, usually um, if a diabetic is not much aware, they start restricting their carbohydrates. And studies have told that if you restrict the carbohydrate, it's okay, but don't stop the carbohydrates, because carbohydrates need to be there. Around your 40% of the diet needs to be carb. So, because of the lockdown, that fear or that anxiety that I'm a diabetic, I may not land up into any complications of COVID. Let me not eat much. Let me control my sugar by not eating much. And they start reducing their carbohydrate intake. That is one factor which I feel might be the reason for them getting frail. And secondly, because of the lockdown, the physical activity is less, the fear or the anxiety is more. That also leads to loss of appetite. I don't know, but yeah, many people of that age group are feeling anxious, more so if they are diabetic. They have that fear. You hear in your neighborhood, so is ill, so and so got infected. That itself will lead to loss of appetite also. So that is also one of the probable causes. Does that
Okay.
satisfy
And the
or
next question.
answer?
Oh, yeah, sure. Next
Okay.
question is how to manage conditions with stroke, neuropathy, retinopathy, hypertension with type 2 diabetes.
Okay, I can explain it and go on and on for that. So these are the
You have
complications.
explained that.
No,
Uh,
no
uh,
problem. I have no problem. So these are the complications of diabetes, like neuropathy, like retinopathy, like nephropathy. Yeah, these are the different organs getting involved because of the diabetes. So if a person has retinopathy, what does retinopathy mean? Retinopathy means because of diabetes, the blood vessels have started leaking. And retinopathy has stages. Stage 1, there is a leak. Stage 2, there is a lot of swelling. Stage 3, there is new vessel formation. Stage 4, it's it's the whole retina which is getting infected. So it definitely there is treatment. The earlier the patient goes on for it, the better it is. If left untreated, it will definitely progress from stage 1 to 2 to 3 to 4 to complete blindness. Yes, India is a country in which the cause of blindness, one of the major cause of blindness is diabetes. So yes, retinopathy can be treated if taken care of at an early stages. Second is neuropathy. Neuropathy is the involvement of the nerves. So as I had told, what happens is the nerves start disintegrating. The nerve covering, the myelin sheath starts disintegrating. You or any medicine cannot make that myelin sheath. But what can be done as a prevention is to see that that myelin sheath doesn't disintegrate. And how that can be done is by a proper control. So if a diabetic is taking proper control of the blood sugar, the chances of disintegration of myelin sheath are very less. And at an early stages, initial stages, when some persons start complaining that they have pins and needles sensations in their foot, that is where we come to know that yes, it is started. And that is where certain drugs, certain medicines do help by slowing that demyelination process, by slowing that destructive process. So that definitely can be taken care of at that early stages. But once it happens, it is really difficult. Then comes nephropathy. Nephropathy is again the involvement of kidney, and that also has stages. That is, what is the first stage? The blood flow to the kidney goes down. The second stage is blood flow going down, the kidneys start shrinking in size. Third stage is their function starts reducing. The urea and the creatinine and the toxic substances are really building up. And fourth stage comes when it is nearly the end stage renal failure, in which dialysis is needed. So whatever the complications of diabetes are, they are something that once that downhill course starts, it is really difficult. So that's why it is said that a good control or a good management of diabetes is needed to avoid those complications, to prolong the good phase, to minimize the level of severity of complications. Is
Yeah,
that
thank
good?
you. And there are some more questions.
Yeah, yeah.
Yeah, yeah. And so, uh, what is the importance of leptin synthesis in relation to obesity?
In relation to?
Obesity.
Okay, obesity. Yeah, so leptin is a hormone which is responsible for the satiety, for the hunger, for that. So what happens when, particularly in obesity patient, leptin is secreted in lot of amount. So what happens? A person is already obese and leptin is being secreted. The leptin causes increased hunger and less of satiety. So it becomes a vicious cycle. The person is already obese, lot of leptin is being secreted. It causes more hunger. The patient eats more and more. And this is the cause that that leptin also has certain implication in terms of um fat cells disintegration and fatty acids accumulation. So leptin is a chemical or a hormone which makes a person more hungry and thereby uh, putting him in that vicious cycle of obesity, diabetes, metabolic syndrome, and deterioration.
Okay. The next question is, what are the precautions to be taken for a child diabetic patient?
Okay, so child diabetic is mainly a type 1 diabetic. Usually, 95% of the time, it will be a type 1 diabetes. So, type 1 diabetes, as I had already told you, is a type of diabetes in which insulin is not at all produced. No insulin in the body. And insulin is not only required for the carbohydrate metabolism, it is required for fat metabolism, protein metabolism, and thereby a lot of vitamins are needed. So all that goes down, and gradually the electrolytes are all abnormal. This leads to deterioration and patient comes into acidosis, which leads to a comatose condition which is called diabetic ketoacidosis. A lot of ketones get accumulated in the body and ketones produce acid. So that is a very serious condition which leads to coma and ultimately death if not treated timely. I had one patient when I was registrar at Gandhi Medical College. We had a child of around 8 to 10 years. It's long back that I remember. And that child came with history of fever. He came from a very remote village and he had only a history of fever, nothing else. And within one day, you know what is the smell of acetone? It's the mushy, fruity odor. The
Yes,
child,
yes.
yeah, the child started having that smell. So what happened whenever I used to enter the ward, I used to feel as if someone is eating some fruits or what. And I used to laugh at him that you are always eating fruits or what. He used to say, no, I don't eat, Didi. He used to call me Didi. No, Didi, I'm not eating. One day and second day, he was not diagnosed till that time. He was not a non-diabetic. He only came with fever, and we were working on it, like blood picture and malaria and throat infection, and antibiotics were being given. Nobody thought of a child of 8 9 years to be having diabetes, and so nobody was checking the sugar. Within 24 to 36 hours I felt that it's something beyond, we are missing something. And that is where we, at that time, one of the teachers used to have the glucometer. We asked them, can we have the glucometer? And that is where we pricked it, and we found the sugar was something around 400 or what, I don't remember. And the urine was full of ketones, and within few hours the child was becoming so drowsy, we had to move him into ICU, but we couldn't save him, and the child died that night only, because the sugar was uncontrolled, the acidic component was so bad. He was rapidly breathing. That breathing is called small breathing. He was so tachypneic, and he died. And he might be suffering from that diabetes, who knows since when. It was only when he started having fever that the family came from a village to, okay, let us go to a capital city, Bhopal, to get him treated. So type 1 diabetes is very florid in presentation. It will not be present for years together. The child will present within few months, and if not treated, it leads to death. So a very high index of suspicion is the only way to come to conclusion that yes, he might be having diabetes. And the earlier you know, the results are very good. Yes, you give insulin, daily insulin, the person will be fine, definitely fine. But yes, the diagnosis is the difficult part in terms of the suspicion.
Okay. The next question is diabetic hereditary?
Yes, so hereditary, according to you people, if you feel that it passes from parent to children, that is not what is hereditary. We consider it something beyond that. But if you want to know, yes, type 1 diabetes and type 2 diabetes both have a component that it can be, uh, there is an increased predisposition. It is not that it has to be passed or it will be passed. There is an increased predisposition of having diabetes in a person whose parents, grandparents, first degree relatives, aunts, uncles have diabetes. They have more chances of getting it. But that doesn't exclude that if I don't have a family history, I will not suffer from diabetes. No, that doesn't exclude it.
Okay. And the next question is, what can you say about cross reactivity of antibodies in type 1 diabetic patients and its significance in other disease diagnosis?
So what antibodies? I'm not able to understand what type 1 antibodies. Because antibodies in
Cross
related to COVID,
reactivity of antibodies.
no, so those antibodies because of COVID-19,
Or
antibodies are
maybe she has
produced.
said that.
Because antibodies are produced against an antigen. So what is the antigen which you are talking about? Is it that antibody is because of COVID, or that antibody is because of influenza? What? And whether, again, you need to know antibodies are of IgM and IgG type. IgM, which is the early recent one, or IgG, which is the late one. If I'm getting it right, Annie, it is about rheumatoid arthritis. Somebody wrote it in the chat box.
I did
Antibody.
not see that. No, no,
It is,
no. Rheumatoid, maybe, yes, rheumatoid
so
arthritis, I
rheumatoid
think.
arthritis is not something related to antibody. Rheumatoid arthritis is an immunological disorder. It has nothing to do with antibodies. Antibodies are something which are produced against an antigen. What rheumatoid arthritis is, it is an immunological disorder in which a lot of chemicals are being produced against your own joint tissues. It is not a pathogenic agent. It is not an infective agent. It is that body has stopped recognizing that this is my own joint and it starts destroying that joint. And there is no definite cause for it. Those are all the immunological disorder, be it systemic lupus erythematosus, be it rheumatoid arthritis, be it multiple sclerosis. These are immunological disorders. That is, in these disorders, body is producing certain chemicals which are attacking the body in itself. They are not viral or infectious agents.
Okay, thank you.
Did I
And there
answer?
are a few more questions.
Yeah, carry.
Um, uh, what about diabetes and bacterial infection?
Yes, it's very, very common. Diabetics, that is what I told you, that diabetes has very high tendency for infections. Not only viral, it is bacterial, it is fungal, all the infections are more prone in a diabetic. And that is what we read about it, that diabetics, because of the poor glucose control, because of the lot of sugar in the blood, the pathogen which enters the body has got good milieu to multiply. The bacteria gets lot of sugar to multiply, to eat it, and therefore it is very common. And diabetics have a poor immunological response. That also we read around. So diabetics have poor immunological response. Their immunity is already impaired. Second, they have sugar in their blood. So, and third, their oxygenation is also hampered. So they are more prone for infections. Their immunity is so much impaired that any infection which might take 2 days or 3 days to be over in a otherwise normal individual may take weeks for diabetic to take care of it. That is why amputations, main cause of amputations in India is diabetes.
Okay. Then the next question is, what
Mhm.
would be the possible side effects of vaccine? Isn't it so early to use a vaccine?
Yeah. So what they saw, the Moderna company in phase 1 trial, they did see. So what is a vaccine? If you really understand, vaccine is that you are injecting that antigen. So if the different companies are preparing it in the different form, like if you understand polio vaccine, what do? The live vaccine of polio will have polio virus injected in your body. They remove the covering of that virus and they inject it in a very low dose and expose the body to that antigen, and then you create an antibody. Your body produces an antibody and that kills it. So you are practically stimulating that disease. So similarly in COVID-19 also, it will be, if you are using a live, because they are really hesitant in using the live material because they have to handle that virus, which is really very dangerous. So still they are trying live vaccine. They are trying with dead RNA virus. They are trying with genetically prepared. So they have prepared that virus genetically and they are creating vaccine for it. Like in rabies, they do the genetically prepared vaccine. So they stimulate the disease. So if you have seen a very mild case of that disease, that is what will be seen as the side effect. That is, the person might have some mild fever, some cough, some lethargy, some dullness. and that is where the antibodies will be being produced, that you have infected the person with COVID-19 and antibodies are being produced. Now it is too early to say how much are these antibodies effective and how long will it last. Will it prevent reinfection after the antibody level goes down? That is why it is too early to state that yes, vaccine coming out, yeah, we will win the race. No, it is too early to comment on. That is what I said. The measles vaccine took around more than 20 years, and that was one of the earliest vaccine to be produced. So if you say that you are producing a vaccine in 1 to 2 years, that is really magical if they are able to do and succeed.
Okay. And the next, there are three more questions which is of
Yeah.
same kind. So I'll ask you together.
Mhm.
Here in Kerala, some people boil guava leaves in water or
Mhm.
coconut shells in water, and they take it as a natural remedy for diabetic.
Yeah.
So that is the first question. How, I mean, whether it is effective or not. The second question is, what are the food suitable for diabetic patients? And the third question, what are the diet remedies for diabetic patients?
Okay.
So almost
So
same kind.
yeah, I understand. Mainly, it is all about the diet in a diabetic patient.
Yeah,
To
yeah.
say or claim that this diet or that diet is effective is really difficult. It will be something which needs to be concluded only after definitive researches and controlled trials, which we don't have, unfortunately. But yes, if somebody is taking guava leaves, or even there are methi seeds, and there are jamun seeds, and there are many things. There are tons and tons of videos on YouTube to treat diabetes by this herb or that herb. Nothing against them, but whosoever is taking that should be very well aware and educated to check the sugar regularly if they are taking this as the only treatment. If they are taking in addition to the allopathic medicine, fine, I can understand. But if they are taking only this as their treatment, and if they are monitoring and they find it really helpful, going for it. All good, wonderful. But then they should be very vigilant that no complications is being produced. Oh, they might be seeing one day they checked it, it is the sugar is fine. After 10 days they checked it, sugar is fine. You don't know when did the eye get attacked, when did the kidney get attacked, because you were only looking for the sugar part of it. And I've told you, diabetes is not just simple a fasting sugar value of 110. It is a syndrome. It is just not that only the sugar value which has to be taken control of. That is one of the indicators which is easy to measure for anybody to come to a conclusion, yes, I'm going on the right track. So don't take it that, okay, I've taken this herb or this naturopathy thing and I'm fine. Be in touch with your doctor, be it a eye specialist, your endocrinologist, that everything is going on fine. Next comes the diet. Any diet which doesn't contain the refined form of the food is good. Doesn't contain absolute neat sugars is good. So fruits, except for like mango and grapes, which are really too sweet, which should be taken in moderation. It's not that you cannot eat or you should not eat. Secondly, all green leafy vegetables and fibers are good. People who are non-vegetarian can absolutely take in moderation, particularly red meat. In terms of legumes and pulses and lentils, it's all good. In terms of carbs, we have to watch like rice and chapatis in moderation. In terms of drinks, anything sweet, carbonated, sugary has to be avoided. So white flour, sugar, sweets, that need to be avoided. Rest everything in a moderation with a very healthy lifestyle. I don't believe will be a big problem in diabetes.
Okay. And the one last question.
Sure.
Uh, People hesitate to take insulin at the beginning stage of diabetes because they think that it will put you as a lifelong diabetic patient. Can you say something about it? That's
My
specific.
sister itself is a diabetic. She started at 35 with diabetes and she was on oral medication. Within 5 years, she was switched to insulin. She took 1 year for me to convince her that she needs to be on insulin, because insulin, you have to prick yourself twice daily, you have to have that needle. She was not ready, but her diabetes was not getting controlled by the oral medication, despite that she was taking good care of her diet. She does yoga very regularly, she does exercise, but it was not good, the control was not good, and she was too young to have those big readings and go on for that for a lifetime. It was difficult. People are hesitant, no doubt about it. Even if you tell me today that I have to take it, I would definitely procrastinate and say no. But when it is advised, that is the main thing which we need to understand. It is not simply advised because your sugar is just not getting controlled, because whatever the way the dose titration of medicine is going on, the sugar is not getting controlled, and you are developing certain other complications of it, which you definitely don't want. So that is the thing that we need to do. And to be very honest, scientifically, the medicines which are taken in diabetics are a second choice. The first choice is always an insulin. But because of the ease of administration, people resort to oral drugs. Otherwise, what is the disease? It is that there is deficiency of insulin. So you need to take insulin. What is a thyroid problem? There is deficiency of thyroid. So you need to take thyroxine. Similarly, diabetes is deficiency of insulin. You are taking certain medication which are only stimulating pancreas to produce more insulin. Something like you are whipping a tired horse that run fast, run fast, run fast. Sooner or later, that horse will not be able to. But if you are giving insulin, you are not tiring the body. You are definitely giving body that advantage. So scientifically, insulin is much better than oral drugs. Have I satisfied the question?
Oh, sure. And it is being so long you are talking, and it is night over there in US. We know that. And now I request my lovely colleague Miss Ambali Elizabeth George to propose vote of thanks to Dr. Anita Bhushan.
Thank you. Thank you.
Respected head of the department of Nirmala College, Dr. Ani Kurian, and our resource person, Dr. Anita Bhushan, the clinical educator and counselor in GIM Foundation, USA. Dear teachers, educators, research scholars, professional students, and all the participants who are interested in this topic. First of all, I thank all of you to be part of this managing diabetes during COVID-19 pandemic. Without much ado, let me directly go into my extending the gratitude. So let me extend my wholehearted gratitude to the principal of Nirmala College, Dr. K.V. Thomas, for giving us all this support for this program. And let me also thank the head of the department, Dr. Ani Kurian, who is a mastermind behind this program. So Dr. Anita Bhushan has been talking to us for almost, more than an hour. And ma'am, let me tell you, you have a very calming voice. And it has been, you started from the basics of COVID-19 and from the basics of diabetes, even from the definition of the basic symptoms. And then you slowly transitioned it into the researches, the studies, and the recent developments, and the immune responses, and how to handle these cases. So we extend our gratitude to you, ma'am, on behalf of Department of Zoology, Nirmala College, to spend your time at this odd hour in Little Rock and sharing your knowledge and insights and giving us your advice. Thank you, ma'am.
Oh, it was absolutely my pleasure to be a part of such esteemed people. And I'm thankful to Annie for giving me this wonderful opportunity. And I'm thankful to all the people who were patient in listening to whatever I said. I don't know if was it really relevant, was it up to the level, I don't know, but I'm really happy and I'm thankful for giving me this wonderful opportunity.
Thank you, ma'am. And let me also extend our gratitude to all the teachers from Nirmala College who has been a part of this and who is the participants, and the non-teaching staff who is giving us all the support. And now I extend my gratitude to all the participants who decided to spend their valuable time with this program with us and asking questions and clarifying your doubts. Thank you all again for being part of this.
Thank you. Thank you so much. I'm happy.
Let me invite our HOD, Dr. Annie Kurin, for some concluding remarks.
It was absolutely a wonderful session, I think. So many people benefited it, I feel. Because being biologists, we also got a lot of insights about the topic. And I hope it was a wonderful session. What about others? I mean, there are many people who did not leave yet. There are 34 more people to leave. So let everybody leave and we will leave. Isn't it?